900 cases per day, and this represents an increase in cases of nearly 11% from the prior 7-day average. The 7-day average of hospital admissions is about 2,000 per day. This also represents an increase of about 7% from the prior 7-day average. And the 7-day average of daily deaths is about 184 per day. These numbers and what we are seeing across the country reveal two truths about the current state of the pandemic. On the one hand, we have seen the successes of our vaccination program over the last 8 months, with cases, hospitalizations, and deaths far lower than the peaks we saw in January. And yet, on the other hand, we are starting to see some new and concerning trends. Simply put, in areas of low vaccination coverage, cases and hospitalizations are up. Further, we are seeing some small clusters and larger outbreaks of COVID-19 in locations such as camps and community events where proper, hard-learned prevention strategies are not enforced and the virus is readily able to thrive. Meanwhile, the Delta variant is spreading rapidly throughout the country. This week, the Delta variant is estimated to be the most prevalent variant in the United States, representing over 50% of sequenced samples across the country, up from 26% from the week ending June 19. And in some parts of the country, the percentage is even higher. For example, in parts of the Midwest and Upper Mountain states, CDC's early sequence data suggests the Delta variant accounts for approximately 80% of cases. Although we expected the Delta variant to become the dominant strain in the United States, this rapid rise is troubling. We know that the Delta variant has increased transmissibility, and it is currently surging in pockets of the country with low vaccination rates. We also know that our authorized vaccines prevent severe disease, hospitalization, and death from the Delta variant. And these results have been observed not just here in the United States, but in other countries as well. Of course, widespread vaccination is what will truly turn the corner on this pandemic. Please know, if you are not vaccinated, you remain susceptible, especially from the transmissible Delta variant, and are particularly at risk for severe illness and death. I want to share with you my concerns about what we're seeing across the country in areas of low vaccination coverage and in counties with increasing case rates. As shown on the left map in blue, there are 173 counties in the United States that have case rates of greater than or equal to 100 cases per 100,000 people over the last 7 days. On the right side of this slide, shown in purple, are the counties in the U.S. that have both vaccine coverage less than 40% and cases of greater than or equal to 100 per 100,000 people over the last several days. Of the 173 counties with the highest case rates, the vast majority, 93%, have less than 40% vaccination of their residents. These counties are where more than 9 million Americans live and work, and are the locations in the country where we are seeing the increased hospitalizations and deaths among unvaccinated individuals. Many of these counties are also the same locations where the Delta variant represents the large majority of circulating virus. Low vaccination rates in these counties, coupled with high case rates and lax mitigation policies that do not protect those who are unvaccinated from disease, will certainly and sadly lead to more unnecessary suffering, hospitalizations, and potentially death. Indeed, as I stated last week, preliminary data from several states over the last few months suggest that 99.5% of deaths from COVID-19 in the United States were in unvaccinated people. Those deaths were preventable with a simple, safe shot. COVID-19 vaccines are free and available to everyone aged 12 and up. Vaccination is our leading public health strategy to stop the Delta variant and bring case rates down in these counties. We are seeing that communities and counties that have high vaccine coverage and low case rates are getting back to normal. Turning the corner on this pandemic, getting back to normal, and stopping the Delta variant requires all of us to do our part and to get vaccinated. Thank you. I'll now turn things over to Dr. Fauci.
Thank you very much, Dr. Walensky. As you heard from Dr. Walensky, the Delta variant is assuming more and more dominance in this country, particularly in those areas of low vaccination. So the logical question one asks is that the vaccines that we are using, how effective are they against the various aspects of disease associated with the Delta variant? If I could have the first slide. First, let's take a look at the mRNA vaccines, which are 2 out of the 3 vaccines that are used in this country, and mRNA overwhelmingly used the most among vaccines. The real-world setting, as shown here, if you ask, cases protected against, a Scotland study showing that 2 doses of Pfizer are about 79% protective. Symptomatic disease, a study from England, again, 2 doses of Pfizer, 88%. And hospitalizations, again in England, 2 doses, 96% real world effectiveness. You can make a quite reasonable assumption that data that are applicable to Pfizer are also applicable to Moderna. Then the next slide, please. The question is, I've just spoken about the mRNA vaccines. What about the J&J vaccines? There's indirect and direct evidence for effectiveness of J&J against the Delta variant. Because if you look at a comparison between the J&J and the Oxford AstraZeneca or the AZ vaccine, because they use similar adenovirus vectors, we have clinical data with AZ in real-world effectiveness. And as you can see, when you look at infection versus symptomatic versus the important number on the bottom of the slide, 92% effective against hospitalization from the Delta variant. Next slide. But there's also other types of data, namely looking at the antibodies that are induced by vaccination with J&J. A recent study that came out a few days ago looked at the blood studies from individuals vaccinated with the typical single dose of J&J vaccine, and it covered the Delta variants and other variants really effectively quite well. Next slide. In a similar related paper, when you look at the durability of the humoral cellular immunity using the J&J vaccine, again, against the Delta and other variants, again, shows not only good protection projected by the antibody test, but also a good durability of that protection out to 8 months. So what's the bottom line of all of this? We've heard about the threat from Dr. Walensky about the increasing in infections. The question is, if you get vaccinated, are you protected? And the answer is, next slide, as shown on this story from the New York Times, the world is understandably worried about the Delta virus variant. But studies showed, as I've showed you on the previous 4 or 5 slides, that the vaccines indeed are effective against it. The only conclusion one can reasonably come to from looking what I've told you over the last few minutes is, please get vaccinated. It will protect you against the surging of the Delta variant. Let me now hand it over to Dr.